The World Health Organization, in collaboration with Sri Sankaradeva Nethralaya and the Assam Government, has launched the Strengthening Provision of Eye Care Services or SPECS project in Guwahati. This initiative, the first of its kind in Southeast Asia, marks a historic milestone in addressing critical eye care challenges for underserved communities. By leveraging Sri Sankaradeva Nethralaya's revolutionary integrated people-centered eye care system, the project aims to develop a scalable model that can be implemented globally. The SPECS project represents a unique partnership between WHO, the National Health Mission under the Government of India, the Government of Assam and Sri Sankaradeva Nethralaya. Focused on delivering critical eye care services to remote and insular communities, the initiative blends global expertise with local innovation to create an impactful and inclusive healthcare framework. The inaugural workshop witnessed the participation of a distinguished cohort of professionals and dignitaries from public health, ophthalmology and government sectors. Dr. Andreas Muller, technical advisor at WHO General Headquarters, Geneva, speaking to Northeast Live, gave more details on the SPECS project.
In the World Health Organization, we are recognizing refractive errors or eye conditions for which people need a pair of spectacles as a major public health issue around the world. Many hundreds of millions of people require access to a pair of spectacles, but they don't currently have that access or they cannot afford the services. So we have launched earlier in this year in Geneva a global initiative to support countries, to support our member states, so that everybody who needs a pair of glasses can be receiving those services.
WHO India National Professional Officer Dr. B. Muhammad Ashil spoke on the launch of SPECS project in Assam.
If you see the public health history of India, if you have to roll out some program, if you have to have some successful public health programs, someone has to show an example. For example, if you want to show the world that it's possible to actually saturate or actually give refractive services for all the people who need. For example, if a population is given some children and adults who are requiring spectacles and who require refractive services, we need to saturate the population. We need to show that this is possible, that all the people who are requiring refractive error services can be given refractive error services. So Assam is a natural choice because one, the level of commitment by the political leadership here, the proactiveness of the health department which has come up in the few years. So and also taking the data, if you look at Assam has a higher prevalence of refractive errors for many reasons. So this is a most ideal location where we can actually pilot something and show the world that this is practically possible. And also we can set an Assam model of implementation which can be reflected and which can actually be replicated in other part of India and other part of the world if possible.
President of Sri Sankaradeva Nethralaya, Dr. Harsha Bhattacharjee, shared the significance of SSDN's collaboration with WHO on the project.
We are collaborating with the World Health Organization, and we are basically will be the technical partner because we have a strong community wing and we have the community service in about more than 2,104 villages, and we have experience on it. So we will take part in designing the IEC material and vision screening material and public awareness program in joint discussion with the other stakeholders. We will try to establish a referral pathway so that after screening, the people should get the proper service, a pair of spectacle and subsequent follow-up. Then translation of the TAP WHO material for vision screening that already been done. In a study, it has been formally launched. Then developing a training module for the vision screening and the training of the human resource. And this will be participating with the government so that we can train the healthcare workers to saturate the program in different parts, different states. And for that, 3 districts will be taken as a pilot project. and liaising with the state government and other stakeholders for successful implementation of the program. So this will be our technical partnership.
And Dr. Ravinder Singh, senior scientist at Indian Council of Medical Research, spoke on the outcome of the workshop.
Outcome of this workshop over 2 days would be in form of a document which will be prepared jointly by WHO and other partners. Also ICMR is one of them. So this will be the strategy how to roll out the refractive error services or for the provisioning of spectacles across the whole population of first to begin with Assam and then other part of India. And also how to bring down the cost of these products as well as building up of manpower, the service providers and various level of healthcare services preparedness like from CSC, PSC level up to the district hospital and all institutions which can help us whether they are from private sector or whether they are from NGO sector.